Welcome to Tanzania, a land of breathtaking beauty and boundless potential. From the iconic Serengeti to the towering Mount Kilimanjaro and the refreshing waters of Zanzibar, this country holds wonders that inspire the world. But Tanzania's true treasure lies in its people. With 68 million people and the expectation to double by 2050.
Tanzania is growing. It's a young population, but with the life expectancy increasing, it means that in a few years down the line we'll also have an aged population. You know, with Dodoma becoming the capital, and this is where DCMC is located, we now have two different populations. We have a rural-urban mix, meaning that there is an increased need for healthcare service, but an increased need to diversify the kind of health service that is being offered.
In our growing and changing nation, a place like Dodoma Christian Medical Center is needed now more than ever before. For nearly 2 decades, DCMC has been the facility of choice for pregnant women and their families. Up to 70% of our patients are women and children.
Comparing to the nearby hospitals, we are seeing a lot of patients. Most of the patients prefer coming here because they say they get the good care from the doctors, from the nurses.
We are seeing a lot of patients in our clinics. This is because of trust in the services that we are providing to these patients and the outcome. Of course, they're getting a good outcome. Per day is approximately 3 to 4 deliveries, but we are getting a higher percentage of C-sections because of higher risk pregnant women who we are getting from other places. So half maybe C-section and normal delivery.
Our surgical theater is in constant use, not only for OBGYN, but with general and specialty surgery as well.
In a single day of operation, we normally operate 5 to 10 patients, including major and minor surgery. By the moment we have only one room of doing major surgeries, whereby we general surgeons and obstetric and gynecology and also ENT. So sometimes we collide 2 departments. You need to do an emergency surgery. So it was difficult how to handle. But in good luck, now we are expanding our new surgical buildings by the support of this Tanzania Health Partnership. And this will bring more benefit and additions of surgeries, as we have at least 3 operating rooms can run at the same time. So the new building will bring us a new growth for increasing the number of patients.
The new surgery center will allow us to care for more patients like Kalunde.
Nikaonekana ninagoita. Nilikuja hapa baada ya kuwa nimeambiwa hospitali hiyo ya Dar es Salaam, niliambiwa kwamba goita langu limekaa vibaya. Uwezekano wa kuishi ni mdogo 50%. Kwa hiyo nikaogopa. Mdogo wangu anaishi hapa Dodoma Ntiuka hapa. Alishafanywa operation hapa. Alikuwa na changamoto ya uzazi. Akaja hapa kuonana na madaktari wa hapa DCMC akapata mtoto. Kwa hiyo mimi nikashawishika kwa sababu mdogo wangu alifanikiwa hapa. Kweli nikaja hapa huo nikafanywa upasuaji. Shingo yangu ilikuwa imeharibika, lakini namshukuru Mungu hata mshono hauonekani, unaenda unaishia. Nawashukuru madaktari wa DCMC. Kwa kweli Mungu azidi kuwabariki.
We are also transforming lives through our vision care, both here at the medical center and in the community through our outreach programs.
So we have an eye clinic at the DCMC hospital, and the clinic has grown up for a few years to a modern eye clinic, I think, in the central Tanzania. We recently had a camp. We actually had a patient from all the 7 districts of Dodoma coming to DCMC, attending for a camp. And many people had disease which were already advanced. The problem is they had no money. They never had a chance to see an ophthalmologist because we are also few in the country. And in this camp, actually, we saw very many patients. We saw about 692 patients, and we did about 35 patients who had different surgical needs. And we are happy, and the impact of the camp is very huge. When the patients come, they don't only attend the eye clinic, they also get to know the DCMC in its service. They get to know what we provide at DCMC. So when they attend for the eye clinic, they also get to know the other services which are provided. That's why I say the camp has a very great impact to the development of our hospital in general.
At DCMC, care isn't just about medicine. It's about compassion, trust, and treating every patient with respect. This is the heartbeat of our mission.
I think the healthcare needs in Dodoma have never been greater. There's always a need, but it appears now that there's a greater need since we have a bigger population in Dodoma than there was ever before. I've been on the board of DCMC now maybe over 5 years. I've seen how the donations have helped. So I've seen departments grow, I've seen more hospital beds. You see happy children, really happy mothers that have come and have accessed healthcare at DCMC. And this is due to the generous contributions, and from the bottom of our heart and on behalf of DCMC, I would like to say thank you for the individuals that have donated, for the organizations, for the churches. I don't know if there are any better words, but thank you. And when we say thank you very much, in Kiswahili we say asante sana.